When there is a need for the use of laxatives, in what cases is it necessary to prescribe laxatives for preventive purposes? What products have a laxative effect? How does traditional medicine suggest to affect constipation? From what complications of constipation will normalization of the stool protect? In what cases is it not indicated to use laxatives? Watch the video to the end. You will understand how important it is that the stool is regular and what to do to regulate the process of intestinal cleansing. The human body is designed in such a way that toxins and slags are excreted through the kidneys and intestines. It happens that there are problems in the work of the intestine. If the stool is absent for more than 3 days, then they talk about constipation. Laxatives are used to restore the activity of the colon. When is it necessary to use laxatives? Laxatives are used to stimulate intestinal cleansing. The need for this occurs with constipation. Constipation is understood as difficulty in the process of emptying the intestine. Going to the toilet for defecation at least twice a week. Allocation of stool in small portions. Feeling of only partial bowel emptying. Urge to stool without defecation, abdominal pain. Constipation can be chronic when the situation persists for a long time and requires the use of special means. With chronic constipation, the rhythm of going to the toilet changes, the stool becomes dry and dense. It is necessary to solve the problem when it occurs, since it can lead to the development of serious diseases such as oncology and emission. Constipation occurs most often in young children and in people over 60 years of age. Constipation can be caused by various situations that arise in life. It is not to be a problem, but to arise situationally. This can happen during pregnancy, when eating foods that lower intestinal motility, while traveling, when there are no comfortable conditions for going to the toilet. Situational constipation, as a rule, is resolved without the use of additional means. The causes of chronic constipation can be recurrent episodes of restraining the urge to defecate, lack of the necessary amount of fiber and liquid in food, frequent stressful situations leading to the development of irritable bowel syndrome, when diarrhea and constipation may alternate, mechanical obstacles in the colon, tumors, polyps, parasites, adhesions, neurological disorders that occur in diseases of the brain and spinal cord or spine, diseases of the rectum, which are characterized by pain during stool excretion, which leads to the fear of going to the toilet, stops the excretion of feces, psychological trauma, stress, depression, nervous disorders. To normalize the stool, first of all, you should adjust your lifestyle and diet. Everyone is recommended to observe a sufficient regime of physical activity, perform special exercises that increase the intensity of bowel movements. In what cases is it necessary to prescribe laxatives for preventive purposes? In some cases, due to the possibility of hindering the proper functioning of the intestine, laxative diets are prescribed, and more serious means are used to promote bowel emptying. Women in the postpartum period, when hormonal restructuring of the body occurs, the location of internal organs changes, the correction of the diet is carried out. With intestinal dysbiosis, when as a result of insufficient activity of the microflora, intestinal motility suffers. After operations and against the background of severe injuries, so as not to cause additional stress to the body. When using medications that have the ability to reduce intestinal activity, these are antidepressants, some anti-inflammatory drugs. If with age there is a violation of the regularity of the stool. In the case of existing problems with blood vessels, for which increased efforts during defecation can lead to serious consequences, for example, hypertension with weakness of the heart muscle. What products have a laxative effect? With chronic constipation, it is necessary to follow certain rules of nutrition. The diet should be with at least 4 meals a day, drinking water in the amount of 1.5–2 liters. Among the products that help to remove toxins, vegetables and fruits rich in vegetable fiber, bread made from roughly ground flour, various cereals, fresh kefir and natural curdled milk must necessarily be. Be sure to use bran during breakfast, a tablespoon of which should be poured with boiling water for 30 minutes, and then add to porridge or kefir. You can juice. Freshly squeezed vegetable and fruit juices, prepared smoothies with the addition of green vegetables, stimulate the work of the intestines. All vegetable oils have a laxative effects. Linseed and olive oils are especially useful in this regard, but they should not be refined. Products made of refined flour of the highest quality, rich pastries, fatty meat, smoked and canned foods, sweets, hard-brewed coffee and tea should be excluded from the diet. Do not eat vegetables and fruits that lead to increased gas formation. These are grapes and cabbage, legumes, sorrel and spinach. How does traditional medicine suggest to affect constipation? If it is not possible to adjust the diet and the use of various products, or a sufficient effect does not occur, then you can use folk recommendations, including not only the use of herbal decoctions and infusions, but also the use of prepared intestinal stimulating compounds. On an empty stomach, take every morning a tablespoon of olive oil in combination with a teaspoon of lemon juice. Wash down with a glass of water. A glass of orange juice with pulp mixed with a tablespoon of linseed oil. Prunes have the ability to enhance intestinal motility. Contain sorbitol. It is a sugar with a laxative effect. Several fruits should be consumed in the morning and several at night. In the morning, you can add dried seaweed or flax seeds to breakfast. They will help maintain regular stools. Vaseline oil, almond oil, take a tablespoon twice a day. These means can be used in children's practice and for bedridden parents. They retain water in the intestines, which helps with the release of toxins. Berries and viburnum juice contribute to the onset of the effect 2–3 hours after taking them. It should be taken in several portions with small breaks. Buckthorn bark, brewed with boiling water based on a glass of 10 grams of raw materials, it should be infused for 20 minutes. Drink half a glass first and after an hour everything else. The laxative effect is provided by a salt solution prepared from a liter of water and a teaspoon of salt. Drink 2 glasses at once on an empty stomach, the remaining portion as the effect occurs. Aloe juice, if taken in the volume of a tablespoon on an empty stomach and washed down with water, has a good laxative effect. Infusion and decoctions of herbs such as licorice, St. John's wort, chamomile, senna contribute to the normalization of stool, excretion of toxins, intestinal cleansing. From what complications of constipation will normalization of the stool protect? If you do not try to normalize the stool, then chronic constipation leads to serious consequences. Coprostasis, formation of fecal stones, and even the possibility of the intestinal obstruction. Chronic intoxication resulting from the reabsorption of toxins in the blood. The formation of hemorrhoids, with the formation of unpleasant and painful sensations. Chronic inflammatory process in the intestine. Compression of internal organs, violation of urination. Against the background of the constant presence of compacted fecal masses, conditions are created in the intestine for the appearance of a tumor. The appearance of trophic changes in the colon mucosa, with possible perforation and development of peritonitis. To prevent constipation from progressing, intestinal cleansing occurred regularly. There were no complications that could significantly worsen the condition. It is necessary to use home measures to regulate stool, and if they do not help, then consult a doctor. The use of medications with a laxative effect is not carried out without a doctor's appointment. This can lead to serious consequences, deterioration of the general condition, disorders in the work of the body. In what cases is the use of laxatives not indicated? In order to maintain normal functioning, it is necessary that the stool be daily, or at least once every 2 days. If such a regime changes, defecation is delayed, then laxatives are used. However, laxatives can be used and not quite for their intended purpose. Then they accustom the intestines to the need for stimulating effects. It can be, if you want to lose weight, when laxatives are used to enhance intestinal motility, they stimulate the excretion of not only feces from the intestine, but also fluid, which leads to dehydration. Some people have the impression of an insufficient amount of excreted toxins. With daily regular stools, then laxatives are used, which disrupt the normal functioning of the intestine, lead to a violation of water-salt ratios. Do not use some laxative substances if you have an allergy or individual intolerance to them. It is contraindicated to use any laxatives without a doctor's recommendation with existing chronic diseases such as metabolic syndrome, diabetes mellitus, the presence of tapeworm feces, which may be a symptom of intestinal oncology. You should not use different laxatives, medicines, and herbs yourself during pregnancy. This can stimulate uterine contraction and cause premature birth or miscarriage. If there is no result from changing the diet, using home remedies, then you should consult a doctor, take tests, and if necessary, do research.